Welcome to Dr. David Eifrig's Health and Wealth Bulletin. This is Weekly Update. It's June 1st, which means we're now at the start of National Aphasia Month. And if you don't know what that means, you need to keep watching today's video. Aphasia means you have difficulty with language. The A means without, and phasis comes from utterance, or phonai, to speak. So what it really means is without speech. But aphasia encompasses not only a lost ability to speak, but may also include a loss of the ability to read, write, or comprehend speech. Aphasia is the result of head trauma, so concussions, traumatic brain injury, even infections can cause it. But the most common cause is stroke. In fact, about 25% to 40% of stroke survivors develop aphasia. It's usually when the left side of the brain is damaged during the stroke. That's because the left frontal area is responsible for speech and communication. Now, it's important to keep in mind that this isn't like Alzheimer's. There's no problem with thought processing or memory. It's only communication that's affected. So taking steps to improve communication skills is crucial for recovery. If you or a loved one are suffering from aphasia, consider a speech therapist. There are also some great resources through the National Aphasia Association. We have a link for you below in the description, so be sure to check that out. What's more, about 2 million Americans suffer from aphasia, and that makes it more prevalent than things like Parkinson's disease. But hardly anyone knows what it is or what causes it. Now, as I mentioned, aphasia usually comes as a side effect of stroke. That's why today we're covering some of the basics of strokes to give you the information you need. Stroke is the #1 cause of long-term disability in the U.S. About 800,000 people every year have a stroke, and about 75% of those folks are over the age of 65. Stroke is also the 5th leading cause of death, with about 133,000 deaths each year. Heart disease, cancer, chronic respiratory disease, and accidents are ahead of it. Now, there are different types of strokes, each with a slightly different cause. Ischemic stroke means a clot has formed in your blood vessels. That clot blocks all the blood flow to a part of the brain, which cuts off oxygen, and that brain region then suffers damage. If the blood is blocked for more than a few minutes, the brain cells in that area will die. Now, the clot may either form right there in the artery, or it may form elsewhere, break off, and travel up to the brain artery. In fact, these traveling clots can form after a heart attack, or even as a result of atrial fibrillation, or AFib. That's when you have an irregular heartbeat. Now, the second type of stroke is a hemorrhagic stroke. Hemorrhage means to bleed out from a damaged vessel. So if a blood vessel in the brain ruptures and bleeds out, that can also cause a stroke. There are also things called mini-strokes or transient ischemic attacks. That's when you get a blockage from a clot, but it moves, so the blockage is only temporary. These are typically warning signs of a major stroke that could happen in the future. And they're dangerous because they often cause symptoms only for a few minutes or hours, so people are likely to dismiss them. You might be at risk for a stroke if you suffer from high cholesterol, high blood pressure, diabetes, sickle cell disease, or any blood vessel diseases. Also, if you've already had a stroke, you're at a much higher risk of having another. What's more, you may not know that depression also increases your risk. An Australian study in 2013 demonstrated that middle-aged women with depression had more than twice the risk of a stroke compared to those without depression. And that's even after accounting for other factors. The reason isn't clear yet, though some researchers believe it's because inflammation in the brain contributes to both diseases. This is one of the many reasons we stress diet and exercise as a way to fight chronic inflammation. Enjoying foods with nutrients like lycopene, which is found in tomatoes, is a great way to lower stroke risk. Similarly, artificial sugars and ultra-processed foods increase inflammation, so try to cut out things like that diet soda you're having for lunch. Now, we also want to cover how to spot a stroke. Remember the acronym FAST. face drooping, arm weakness, speech difficulty, time to call 911. Keep in mind, though, there are other symptoms you should watch for, including trouble speaking, walking, or balancing. You might also experience vision issues like blurred vision or trouble seeing. Tingling and numbness may appear in the face, the arm, or the leg, typically on one side of the body. You might also experience severe headaches, confusion, muscle stiffness, trouble swallowing, or even memory loss. Getting help immediately is crucial to preventing further damage to the brain after a stroke. So if you or a loved one experience any of these symptoms, even for a short period of time, be sure to seek help immediately. That's it for today. If you want to learn more about strokes and the possibility of aphasia, don't forget to check out the information linked in the description below. In the meantime, keep your questions and comments coming to our feedback line. Like, share, and subscribe, and we'll see you next week.